Vitamin D, also known as ergocalciferol D2, cholecalciferol D3, and alfacalcidol, is a fat-soluble vitamin that helps the body absorb calcium and phosphorus. This is crucial for building and maintaining strong bones. Vitamin D is used to treat and prevent bone disorders such as rickets and osteomalacia. It is also used to treat or prevent bone loss, osteoporosis, when combined with calcium. Additionally, vitamin D is used with other medications to treat low levels of calcium or phosphate caused by certain disorders. The body naturally produces vitamin D when the skin is exposed to sunlight, but factors such as sunscreen, protective clothing, limited sunlight exposure, dark skin, and age can prevent the body from getting enough vitamin D from the sun. In cases where breast milk has low levels of vitamin D drops or other supplements are given to breastfed infants. For optimal benefits, it is important to take the recommended daily dosage of vitamin D as prescribed by a healthcare professional. The best time to take vitamin D is usually in the morning with breakfast, as it helps the body absorb the vitamin better. If you have any concerns about your vitamin D levels, it is recommended to consult with a healthcare provider for personalized advice. When taking D3 dots, it's best to take them after a meal, but you can also take them with or without food. If your doctor has prescribed this medication, be sure to follow their directions for the correct dosage. This will depend on your medical condition, sun exposure, diet, age, and how you respond to the treatment. If you're using the liquid form, make sure to measure the dose carefully using a special measuring device. For chewable tablets or wafers, be sure to chew them thoroughly before swallowing. And if you're taking the rapidly dissolving tablets, place each dose on your tongue, let it dissolve completely, and then swallow it with saliva or water. It's important to note that certain medications, such as bile acid sequestrants, mineral oil, orlistat, can decrease the absorption of vitamin D. Try to take these medications at least 2 hours apart from your doses of vitamin D, and it may be easiest to take vitamin D at bedtime if you're also taking these other medications. Remember to take this medication regularly at the same time each day or on the same day each week, depending on your prescribed dosage. If your doctor has recommended a special diet, be sure to follow it to get the most benefit from this medication and to prevent serious side effects. And as always, if you think you may have a serious medical problem, seek medical help right away. If you have been prescribed D3 dots by your doctor, it is because the benefits of taking this medication outweigh the risk of side effects. Most people do not experience any serious side effects when using this medication at normal doses. However, it is important to be aware that taking too much vitamin D can lead to high levels of calcium in the body, which can be harmful. If you notice any of the following symptoms, it could indicate high levels of vitamin D or calcium: nausea, vomiting, constipation, loss of appetite, increased thirst, increased urination, changes in mood or behavior, or extreme tiredness. If you experience any of these symptoms, it is important to contact your doctor immediately. While a serious allergic reaction to D3 dots is rare, it is important to seek medical help right away if you notice any signs of a severe allergic reaction, such as rash, swelling, severe dizziness, or difficulty breathing. It is important to note that this is not a complete list of possible side effects, and if you experience any unusual effects not mentioned here, it is important to contact your doctor or pharmacist. The recommended daily dosage and the optimal timing for taking this medication will be determined by your doctor based on your individual needs. Before taking D3 dots, make sure to inform your doctor or pharmacist if you have any allergies to vitamin D products or any other allergies. It's important to discuss your medical history, especially if you have high calcium or vitamin D levels, difficulty absorbing nutrition from food, kidney disease, or liver disease. If you are using liquid products, chewable tablets, or dissolving tablets, they may contain sugar and/or aspartame, and liquid products may also contain alcohol. If you have diabetes, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances, be sure to talk to your doctor or pharmacist before using this product. If you are pregnant, it's important to only use doses of vitamin D greater than the recommended dietary allowance when clearly needed. Be sure to discuss the risks and benefits with your doctor. And if you are breastfeeding, consult your doctor before using D3 dots. It's important to be aware of potential drug interactions when taking D3 dots. This could affect how your medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. They can help you determine if there are any potential interactions with other medications or herbal products. Some products that may interact with D3 dots include burosumab and phosphate binders. It's also important to check the labels on all prescription and non-prescription products, such as antacids, laxatives, and vitamins, as they may contain calcium, magnesium, phosphate, or vitamin D. Your pharmacist can provide guidance on using these products safely. It's also worth noting that vitamin D is similar to calcitriol, so it's important not to use medications containing calcitriol while taking vitamin D. Additionally, vitamin D may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are taking vitamin D. As for the daily dosage and optimal timing, it's best to follow your doctor's recommendations. They can provide personalized guidance based on your individual needs. Always consult with your healthcare provider before starting, stopping, or changing the dosage of any medications, including D3 dots. If you or someone else has taken too much D3 dots and are experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, while in Canada you can call a provincial poison control center. Symptoms of an overdose may include seizures, confusion, and irregular heartbeat. It's crucial to get help right away in these situations. When taking D3 dots, it's important to have regular medical tests to monitor your calcium, magnesium, and phosphorus levels. Make sure to keep all your medical and lab appointments, and consult your doctor for more information. In addition to taking D3 dots, you can also increase your vitamin D intake by consuming foods that are rich in this vitamin. These include fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. It's recommended to take D3 dots as directed by your doctor. The daily dosage may vary depending on your individual needs. It's best to take this medication at the same time each day to maintain consistent levels in your body. Always follow your doctor's instructions for the best results. If you forget to take a dose of D3 dots, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the regular time. Don't take double the dose to make up for the missed one. When it comes to storing vitamin D products, it's important to keep them at room temperature and away from light and moisture. Make sure to store alfacalcidol drops in the refrigerator, but be careful not to freeze them. And of course, always keep all medications out of reach of children and pets. When it comes to getting rid of any expired or unneeded vitamin D products, it's important to do so properly. Instead of flushing them down the toilet or pouring them down the drain, it's best to consult your pharmacist or local waste disposal company for the correct way to dispose of them. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.